Muhammed Munir, who's a molecular virologist at Lancaster University. Muhammed, welcome to the programme. Now, we used to speak almost on a weekly basis during the COVID-19 pandemic, and just what would be your message to our viewers who are hearing this message right now from the WHO about Mpox?
Thank you very much, Maria, once again having me here. We know that monkeypox, which is now being called Mpox, has been prevalent in the Africa for a long period of time. And for the last couple of months, it's been spreading, and spread has been through mutation, through changes in some of the Mpox viruses, and that is a specific clade. And this increase in transmission was evident would lead to higher spread and also the mortality. And for last 4 months or so, this has been ongoing. So it was very evident, and as was, for example, projected by the African CDC on Monday, that it is a public emergency, and as is now reiterated by the World Health Organization. And this is really of a concern, not only within Africa, where it is spreading lavishly, but also it could pose a concern and the risk for other parts of the world as well.
And on that very point, Tedros Adhanom Ghebreyesus, WHO director, said following that the potential for further spread within Africa and beyond is very worrying. Those are the words of the WHO chief. How quickly can this spread? And also, Mohammed, just at this point, how quickly has it spread? And is it under control?
No, it isn't really under control. I mean, the Mpox viruses can be divided into two different groups. They're called clade 1 and clade 2. Clade 1 is the one that is the most pathogenic, and that is primarily in the Central Africa has been spreading quite extensively. Clade 2 is less pathogenic, and that was the one that we have witnessed in 2022, 2023 in Europe. So this clade 1 actually has mutated into something that is more transmissible. So it's spread between people quite quickly. And although the spread is dependent on to how close the interaction between the infected and the uninfected person is, yet it is more pathogenic, it's more transmissible. Therefore, the spread has been, within 4 months, we have witnessed around 13 countries reporting the Mpox, and 4 of those countries are the one they haven't reported this kind of Mpox cases before. So it's spread quite quickly. And when it comes outside of the Africa, that is primarily through travel. So people who are infected, whether the infection is at the early stages, they are not really aware of that infection, and then they travel to outside of the Africa. That is where they bring the infection. And in majority of the developed nation, and we don't really have the immunity against it. So therefore, once it occurs into a community, it's spread within the community quite actively.
You've mentioned many points there, and that may, I'm sure, very concerning to our viewers. Travel, international travel. Can this be detected? How is it detected? Are we even set up to detect Mpox at early stages?
Yeah, early stages detection is really a problem because the symptoms are generally symptoms for any other infection like fever, muscle aching, and body aching. But actually the disease is more easy to detect when it is in later stages, when the rashes and the lesions start developing, particularly around the neck and the face region on the back of the ear. That's really the common area where it could be identified through visual inspection. But there are tests available, both fast tests as well as molecular tests available. And I think now here the question is that how quickly we can collate those resources, deploy that one within the regions where, particularly the DRC, Republic of Congo, where 96% of the reported cases are being identified. So how quickly we can deploy those ones so that even if the traveling is happening, at least we know that the infection is either spreading, or if people are detected positive, there's something that can be done to really mitigate that. And I think this is really the test for the globe.
Muhammed Munir, thank you so much for speaking to us and giving us this information about the World Health Organization declaring Mpox outbreaks a global emergency. Thank you.
Thank you for having me.